Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hand. It is Wartenberg's test. It is looking for Wartenberg sign. Now this was first described by neurologist Dr. Robert Wartenberg back in 1939, and he found that people who presented with an ulnar nerve palsy, that they were not able to abduct their pinky finger, that they would sit in this position with their pinky out. The reason for this is that when the ulnar nerve has this palsy going on, this issue, the palmar interossei muscles are not able to adduct the fingers, so they cannot bring the fingers back to this position. Now you may be saying, well, doesn't the abductor digiti minimi abduct the finger? Like, yes, it does. However, because the radial nerve is still intact, the extensor digiti minimi is still intact, which is down through here, and it attaches here, so it sits unopposed, and so the finger stays out in this position like this. To perform this test, you want a firm, smooth surface. You're going to have the person put their hand on the table here, and then you abduct their fingers, so bring their fingers out. Then you're going to ask them to please bring your fingers back together. So if they can, it's a negative. However, if that pinky kind of hangs out like that, or they have a hard time bringing it back, it's a positive. There are no studies about like the reliability, sensitivity, or specificity, because if you present like this with an ulnar nerve injury, you just probably have it. However, there is one article out there that they were comparing these motor tests to a ulnar nerve motor conduction velocity test, and found that if you do present with a positive Wartenberg's test, you are more likely to have a slower motor nerve or nerve motor conduction velocity. So because even Dr. Wartenberg way back when said that this is present with late stage ulnar nerve palsy. So there you go. That is Wartenberg's test, which is looking for Wartenberg sign. Let me know, what do you think about it? Have you ever found this with somebody? Do you actually utilize it? So let us know down in the comments below. And like always, take care of yourself, take care of your patients. We'll see you next time.